Hi, I'm Greg, and I'm here with Justin, and we're going to walk you through a demonstration of the LifeLink Emergency Department chatbot. Justin, are you ready for this?
Let's do it.
Okay. So before we get in, we thought we'd just give you a little bit of context about why chatbots in the emergency room are a good idea. We'll walk you through a couple different scenarios, and then we'll talk about a real-life example you can check out. So let's begin by talking about the opportunity at hand. And I think oftentimes you don't read much about patient engagement innovation in the emergency department, yet it's a pretty big deal, isn't it?
Yeah, it's one of the highest volume service lines in a hospital, and it's the front door for a lot of inpatient and outpatient procedures as well.
Right. It's a pretty hard place to innovate. Very unscheduled, unpredictable, lots of trauma.
Right.
Hard to manage, but also a big source of massive patient dissatisfaction.
That's right.
So let's get into it. How would you solve such a problem? Well, first off, at LifeLink, we look at the end-to-end process, and we start from the moment you walk up to the front door until the moment you check out. Anything you want to add to that before we get into the demo?
Yeah, I think if you're a typical patient, you don't visit the emergency room very often. And so what might feel very routine to someone that works in an emergency room might be very difficult for patients to understand. And part of what we do is help patients and guide them throughout that process so they understand where they are, how much longer they're going to be there, why they're waiting, et cetera.
And I think it's also important to note that to deliver this kind of experience, it's often a requirement to be stitched into a back-end EHR system, which we're going to walk through a couple of examples of how that might operate in the demo.
Right. There's all this rich clinical data that sits in the back-end EMR that patients aren't exposed to during their visits, but the care teams know about. And what we hear a lot is that patients feel like they're in a dark room and everyone outside that room knows what's going on. So part of what we do is integrate directly with that EMR so that we can expose data as it's relevant to provide patients with these updates.
Right. Okay, so let's get into it. So we're going to walk through a couple different scenarios. The first being activation and orientation, just what happens when you show up. We'll show some examples about how we deliver lab ETAs. And lastly, and this is often very important to a lot of the providers, is just the idea of promoting the patient portal, how patients can log in and get all that other information that's important to them. So let's start. Justin, activation and orientation. How exactly does that work? I've broken my arm. I've walked in the front door of the ED. I've gone to the check-in desk. What happens?
Well, you'll get a text message as you're walking from the registration desk to the waiting room that is inviting you to start interacting with this digital assistant that'll keep you updated throughout your visit. So it's through SMS, it's browser-based, there's no app to download, and that's why we see such a high percentage of patients interacting with the chatbot.
I see. Okay. So let's get into it. You get the SMS, you click on the link, you pop over to Safari or Chrome. What happens next?
So once you click on that link in your SMS, it'll open your browser, no app download required, and the chatbot will greet you and welcome you to the emergency room. So you've authenticated. It says, hey, Justin, you're officially checked in the emergency room at Westpath. I'll send you personal status updates during your visit. And we know that there are certain types of questions that patients have at various points of their journey, starting from when they're in the waiting room. They want to know when they're going to see a doctor. And oftentimes when you are checked into the ER, you're texting your mom, you're texting your dad, you're texting friends and family, whoever needs to know and whoever's going to pick you up, where to meet you. But at a big hospital center, that can be very confusing. You don't know which emergency room it is, where to park, where to find you. And so one of the first bits of help that a chatbot can deliver for you is to give your friends and family a map of exactly where you are and how to find you. So it puts you and your companions at ease.
Okay. In addition to that, I can imagine there's other bits of information that the bot could deliver, where the bathrooms are, where to get food, can you leave? I mean, there's got to be a long list of questions that can be delivered, not just when you first arrive, but during the whole duration of your stay.
Right. There can be hundreds of these frequently asked questions that a patient might have throughout their visit.
Okay, cool. All right, so now you've been informed. Maybe you've been called in and you've had an x-ray or given some blood. And that's often a very frustrating thing because people don't understand how long it takes to do labs, especially if they're sitting there in throbbing pain or think they're having a heart attack. So this idea of lab test, imaging test result, ETAs, is a juicy one for hospitals.
Yeah, it's one of the leading causes for dissatisfaction in the ED. You've been roomed, you've seen a doctor, they order a whole bunch of tests, they collect the samples, and then they leave. And you're sitting in the room and you have no idea what the status of any of those tests are. Did they get to the lab? Are they in process? Is the doctor already reviewing them and they just are backed up and can't tell me? So one of the best things we can do in the ED to help patients while they're roomed is to expose some of that data from the back-end EMR and show them, these are the labs that your doctor ordered. This is how far along they are, because we can see that from the back-end systems, and provide actual wait time estimates based on all of the past turnaround time data for hundreds of thousands of labs that have occurred in prior years.
Right. So you're saying there's a little bit of math algorithm going on here that's doing some science behind the scenes. It's not just pulling this data directly from an EMR. It's meshing a number of different things.
That's right. If you think about algorithms that can take by diagnostic type, the average turnaround times by time of day and day of week, et cetera, and roll those all up into a ETA, it feels very simple to the patient. It feels almost like a Domino's pizza tracker, but on the back end, LifeLink is crunching a ton of numbers and turnaround time data to deliver that update.
Okay, well, let's check it out.
So you can imagine that the chatbot has reached out to you multiple times now while you're roomed. It's told you what types of labs are ordered for you, what the initial ETA was, and now you've been sitting in the room for an hour or 2 hours, and the chatbot is reaching out again because it knows that, A, you're probably ready for an update, and B, it actually has an update to share with you. And making it visual is one of the most powerful things we can do for patients, so that they're not stuck interpreting a whole laundry list of all the labs that were ordered and expecting turnaround times, that we're actually distilling all of that into just one very easy to grasp image, which is, this is exactly how much of your labs are done. And if the hospital care teams are comfortable with it, we can actually expose an ETA that's minutes, so that the patient knows roughly when they should expect a nurse or a doctor to come back and talk to them about the results of their diagnostics.
Right. This is a good example where there's a lot of intelligence, artificial intelligence going on behind the scenes to deliver that very, very simple image that you're seeing there on the demo.
Right. It looks deceptively simple because there are things like a pregnancy test where the results of that have to come back before you can have a woman who may or may not be pregnant go through an x-ray, right? So the average x-ray turnaround time is not appropriate because you know that you have to wait for the pregnancy test to come back first. And there are hundreds of rules like that around the types of labs that you might expect to be ordered in the emergency room.
Right. Okay. So cool. All right. So let's move on to another one. And this is something that's near and dear to a lot of hospital systems' hearts. And that is, how do I better promote my EMR portal that I've spent $1 billion on? And we're trying to get people to use this thing. And here you've got some engagement going in the ED with all these patients on the stuff we've just shared with you. And now you've got an opportunity while they're captive to promote access to these portals for the patients.
Yeah, one of the concepts that I think hospitals have had limited chances to exercise is this idea of contextual public service announcements, right? You want to explain the value of the portal and why patients should download it and activate it when it's most relevant for them. It's not a mailer that comes a month after your visit that encourages you to download the portal. It's when you're sitting in the emergency room, you know that you're going to be getting lab results back, and you want to have a way to view those lab results and share them with your family. So this is one of those contextual moments where it's the perfect time for a bot to deliver that type of advice and guidance to a patient.
Okay, so how would that look?
So in this particular conversation, what's happening is the chatbot sees that discharge disposition has changed. So we know that you're going to be dispositioned and discharged to home instead of to inpatient care. And we know that that means your condition was not so severe that you need to be rushed into emergency surgery. So you're a good candidate for this type of portal pitch. And at this moment, the chatbot also knows that your emergency room doctor has added referral instructions for you to follow up with your primary care provider to make sure that you're recovering smoothly after your visit. And while the chatbot can summarize the key points of those discharge instructions and help guide you to that PCP referral, it can also encourage you to go and download MyChart in this case, because the hospital is an Epic customer, to view their full discharge instructions. And one of the nice things about a bot interacting with you on your mobile phone is when you click, sure, I'd like help downloading the MyChart app, it opens the App Store, so it guides you right to that download page.
Right. Which is the beautiful thing about a mobile phone, is all that capability is in the same place. So you may be interacting with a chatbot in Safari on the phone, but if you want to link over to the App Store, it's embedded technology. You don't have to download the App Store. It's already there. Right.
And if you think about a high volume ED with 50,000 patients coming through every year, that's a very ripe opportunity to improve portal activations and downloads for all the patients getting discharged.
Right. So, okay, cool stuff. And you can imagine there's a lot of stuff that could go on with a bot after you discharge from the ED. And we have another webinar that talks about referrals, which you'll find on the LifeLink website, hopefully right next to this one. So let's talk about one more thing, and that is a real use case. So this sounds cool. Demos always look great on webinars, but we actually do have a very large customer that has done a lot of this stuff and has gone public with it. And that's Banner Health out of Phoenix, which, if you're not familiar with them, they're a 28 hospital network in Arizona and New Mexico, Colorado, California, Nevada. 28 hospitals, and they have rolled this bot out across all 28 hospitals with over 1 million patient visits a year. And early indications are that, we're seeing a jump in NPS. Engagement with the bot is far superior to any other technology. Anything you want to add to that?
Yeah, I think the power of rolling out across such a large hospital system is that we've seen a cross-section of rural, suburban, urban sites, and it's patients of every walk of life and every type you could imagine. So this is technology that's now been proven both across multiple types of hospitals, but also different types of patients. And it's very encouraging to see the satisfaction increases and engagement numbers stay steady across such a wide consumer base.
Right. As a matter of fact, if Justin and I had better Spanish, we would show you a Spanish version of this, which has been deployed at Banner.
That's right. Maybe next time.
It's muy bueno. All right. Well, thanks again, Justin, for that. And if you'd like to check out some other demos, check them out on YouTube or at lifelink.com.